it's a device called the Intercept device, new technology for treating previously less recognized cause of low back pain. So I'm pretty excited about it because I think we can really help some patients by offering them this very minimally invasive surgery to help take away back pain that we never really thought about before. It's just another, another weapon in my armamentarium to attack, low back pain.
219-845-1100. Hey, you're on with Dr. Kondamuri.
Yeah, I have a question for Sean.
Hi, how are you doing, sir?
Hi, Sean. I used to go to you back in the 90s and early 2000s to get some shots for my L4 and L5, and I ended up getting Coflex implants.
Okay.
And it was like a miracle for me. But I recently was going down my stairs with somebody holding a desk, and he let go, and it hit me, and my L5S1 is screwed up now. Is there anything I could do besides cortisone?
Yeah, that's a great, that's a common story. What's your name, sir?
Jamie.
What, your first name?
Jamie.
Jamie. All right, Jamie.
Yeah.
All right, go ahead.
So, Jamie, what you and Deborah both described are problems that happen after a fusion. In your case, you had a Coflex implant, and you actually did really well for a long time. In Deborah's case, she had a fusion and didn't do well at all. And Deborah has something called a failed back surgery syndrome, meaning you have severe chronic pain after an appropriate surgery. And you have what sounds like a problem that happens after a surgery that helped you, and then there's wearing down of different parts of your body. For example, in your case, your Coflex was done at L4-5, which is a great surgery, and then now you have problems at L5-S1, and that we call it adjacent segment degeneration. So that means the level next to the level that you had your operation on is now wearing down. Now you might have a stenosis or an inflammation, and there are things you can do for that, non-surgical.
I know the doctor told me it was basically fusing itself. It was bone on bone.
Yeah, so that bone on bone is degeneration. That's wearing out.
So, but I'm diabetic, so prednisone and cortisone I can't take because it raises my sugar.
Yeah, that's a problem with being diabetic, but it doesn't mean you can't have it. You just have to get it very carefully. It has to be given to you very carefully, Jamie. I mean, you can get a steroid, but we have to monitor you very carefully if you do that. Or we have to look at options that are non-steroid options. And there are many non-steroid injection options for treating people who have degeneration or, like a complete bone-on-bone disease next to their surgery.
Mine was, when I came to you, I had shots from different people all over the place, and yours were the only ones that actually worked.
I'm glad to hear that, Jamie.
Jamie, thanks a lot, man. You got a lot of background noise. Where are you at?
I'm in Munster.
You driving or what?
Yeah.
Yeah. Okay. All right. Well, thanks a lot.
Come back again, Jamie, and we'll take a look at it, and I'm sure we can calm that down for you.
All right. I appreciate it. Thank you.
Have a great day, Jamie.
Bye.
All right. You're going to have to re-explain that. So he had a problem in one part of the back. Where's L4, L5?
So I'll show you.
All right. So you got the spine right behind you. Of course,
right here.
Of course you do.
So this is your spine.
Yeah.
All right. Sort of like a guitar.
Yeah,
so this is your spine. Yeah. And this is the lumbar spine. So the low back is right here.
Yeah.
This is L5, L4, L3, L2, L1. That makes up the low back. And between each of these bones, these are the vertebrae, between each bone is a disc. So the disc is a cushion between the bone that kind of keeps the bone separated. And importantly, it separates the bone so the nerves that come out on each side of on either side are not going to get compressed. But if that disc herniates back or protrudes backwards into this opening that the nerve comes out of, well, naturally what happens is that nerve is going to get pinched and you're going to have compression on that nerve root. And if that nerve root is compressed, you get what's called sciatica. If you even have like spinal stenosis from being older, if there's arthritis in that area, that arthritis causes a narrowing of that canal, and that nerve also gets compressed, and you can get pain down into your leg. So if somebody's had surgery, like both Deborah and Jamie, what happens is, let's just say that surgery is done at L4-5, which is what Jamie said. I don't know where Deborah's was done.
It was L4, L5, and then the other one was like something with S1 or something. I can't.
Okay.
Yeah.
So the fusion, let's say that surgery was done at L4-5, which is this level. What happens is this level now is locked down. It's not supposed to move. And the idea is if it doesn't move, then you won't have pain is the theory. But what happens is when this level doesn't move at all, this L4-5 doesn't move at all, then what happens is all the force of the body, the weight of the body compressing down on the spine cannot, this level is rock solid now. So what happens is the pressure is taken on by another level, usually the level below or the level above. And if the pressure and the force is applied to the level below or above, what happens is that disc gets really worn out and you get more accelerated or more, faster degeneration than would normally occur. And that's where people sometimes get bone-on-bone arthritis, where that disc gets completely worn away. Or on the back of the spine, very commonly what happens is these joints, there are joints in the spine, and these joints get worn away. And those joints cause very severe arthritis in the back. And that causes a problem that we can help also. Those are common stories in people who've had surgery. So you may do really well with surgery for a while, but a few years later, you might have trouble.
He's Dr. Sean Kondamuri. It goes like that. And we're talking about Midwest interventional spine specialist, and they're on Calumet in Munster. So we'll see him in a couple of weeks. Anything else, doctor?
No, I think that we had a nice conversation about that. I mean, there are literally dozens of things we can do for the spine to help take away low back pain that are not considered big surgeries. And like you mentioned, the Intracept procedure that I learned about just this week, that was something that is now a procedure that will help treat low back pain without actually cutting into somebody like you'd have for a big major fusion. And people will get relief.
All right, man. Thanks a lot. And we will talk to you soon. There it is. All right, guys. That's Midwest Interventional Spine. And we'll be back with him in a couple of weeks.